Today, we will discuss the correct sequence for measuring blood pressure and some common errors that can affect the reading. First, allow the patient to rest for about 5 minutes. Ideally, measure blood pressure in both arms initially, because a persistent difference can indicate vascular disease, and the higher reading should be used for assessment and management. Keep the patient comfortably seated or lying down, with the arms supported at heart level and free from tight clothing. Apply an appropriately sized cuff, with the bladder centered over the brachial artery. Palpate the brachial pulse and inflate the cuff until the pulse disappears. Note this pressure as a rough estimate of systolic pressure, then inflate the cuff, another 30 mm of mercury. Place the stethoscope over the brachial artery and slowly deflate the cuff at about 2 to 3 mm of mercury per second. The first clear tapping sound, known as Korotkoff phase 1, indicates the systolic pressure. Continue deflating until the sounds completely disappear, which represents the diastolic pressure, or phase 5. Now remember some common problems. Using the wrong cuff size can produce inaccurate readings, especially in obese patients, so the cuff must be appropriate for the arm circumference. An auscultatory gap, particularly in older hypertensive patients, can cause the systolic pressure to be underestimated, so palpating the systolic pressure first helps prevent this error. The patient's arm must also be maintained at heart level, because changes in arm height can alter the recorded pressure. Postural changes can also affect blood pressure. When checking for postural hypotension, measure blood pressure after the patient has been standing for about 2 minutes, and a fall of more than 20 mm of mercury in systolic pressure suggests postural hypotension. Finally, in atrial fibrillation, stroke volume varies from beat to beat, making blood pressure measurement less reliable. In such patients, deflate the cuff slowly and repeat the measurement to obtain a more reliable average. Accurate blood pressure measurement is therefore not simply about applying a cuff. Correct patient preparation, positioning, cuff selection, and technique are essential for obtaining a clinically meaningful reading. Thank you.